Good afternoon. Welcome to 𝐻𝐸𝐧 Academy Live. I am the Note James, as always. So much, focused onto the great results. So that is why I didn't realize that you're all there, waiting for me to begin, because I was really cautious about reading all those stunning scores our students have got for us. It's an absolute honor to come and say, it was about 120 odd students who have made to their dream, isn't it? What else could we ask for? So that is what I was just going through all those face, not the face, the faces. That is what which have made us so proud about their achievement. Monica, good afternoon. Monica is one amongst the many who's waiting to write the exam. Few days to go. Dini Molwagis, good afternoon. Very, very, very nice. I hope all of you have seen those lovely students who have made to their dream. Stunning scores. So if you haven't, please do look at their achievements. And you have to start telling, yes, I will also be there. My face will be there one day after I write the exam. Sri Lakshmi Lechu, good afternoon. Korean Thomas, good morning. Neetu George, good evening. Manju George, good afternoon. A very, very, very precious greetings that includes a very good morning, a very good afternoon, and a very good evening to all my lovely students. Now, why all these three greetings? Because we have people from different parts of the globe, so that means different time zones as well. Kalpana, good afternoon. New name, Kalpana. Sheena Sabu, good morning. Sandhya Bijoy, good afternoon. Ben Siraj, good afternoon. Naisha Joji, good afternoon. 𝐻𝐸𝐵 Abraham, good evening. So, few new names. If you have entered the live for the very first time, please do let me know that you're entering for the first time so that I know, okay, you are new and also where you're from, yeah? Pravina Akshay, good afternoon. Monica, yes, we're eagerly waiting to write and crack it. I'm sure that you will. Shine Johnson, good afternoon. Revati PC, good afternoon. Minchu Tito, good afternoon. Lot of new names. Anybody who's attending the live for the first time, please do let me know. Live attending. Please do let me know that you're attending for the first time and also where you're from, because I would love to know where you're from and I like to add on to my known people's list. That's all. Dia Peter, hi, good morning. It's my first time. So happy, Dia. Very kind of you to let me know that you're here for the first time. May I know where you're from? I'm from Manipur. Kalpana, okay. I think the first person from Manipur, Kalpana. So proud to say that I have now known people in Manipur as well. Very nice. Sidhu Bangalore, Chinnu Anna, good afternoon. Monica, one day my name will also pop up in winners. Of course you will, Monica. Rajani Vinu, good evening. Shia Sunny, good afternoon. Sia Sumi, good afternoon. Right, so I have at least one person who said I am new and I'm from Manipur. Good enough. So the first student from Manipur, am I happy to hear that? And if you have not yet joined our social media platform, we have just pinned, and you have WhatsApp channel, you have Telegram pages. So please do like, subscribe, and follow the very same channels. And these are all free access for you. And that is not for any other reason, just to show that you're all there supporting us. That's all. Surya Susan, yes, I am new. Very nice. Surya, may I know where you're from? Josna Jos, good evening. Kalpana, thank you. Pleasure. Bijish, good afternoon. Josna Jos, first time. May I know where are you from, Josna? Shai Joseph, good afternoon. First time. Very nice. Neetu George, Kalpana is my friend. I suggested this. Thank you very much, Neetu. I absolutely appreciate it. And this is what we love about this. You're all our patrons because you all share all these lovely things. So thank you very much and very much appreciated. Anumol Babu, good afternoon. Shiaz Sumi, first time. Fair enough, Shiaz, may I know where you from? Josmi Johnson, good afternoon. Shiny VS, good afternoon. Rupal Harry, good morning. Prajisha, good afternoon. Surya Susan, me from Singapore. Okay, next time when I'm coming on en route to Singapore, I have another person to meet as well. Good enough. Monica is very kind enough to say, welcome Kalpana to 𝐁𝐿𝐻 family. Very, very, very much highly appreciated. So, Kalpana, thanks, my dear friend 𝐁𝐻 for sharing this link. Very, very sweet of 𝐁𝐻 to do that, because I know that most of you do share, because sharing is the only way to show that you're caring for others. If you feel these classes are going to be beneficial, if you feel, yes, my classes are benefiting you, please do not hesitate to share so that the other of your friends, it can be family members or it can be people whom you are unaware of, they can also be of benefit. Okay, so please do share the very same link if you feel it can be benefiting others. Divya Robin, good afternoon. Jean Bino, good afternoon. Hani Saju, good afternoon. Shajima Kiran, good afternoon. Tangasudha, good afternoon. Hema Koshi, good afternoon. Surya Susan Shore, Sheena Korean, good afternoon. Dinsi Robin, good afternoon. Reshma, good afternoon. Libby Teni, good afternoon. Josna Jos, I'm from Gurgaon. Very nice. So Gurgaon is Punjab, isn't it? Somewhere over there. I had few people from Punjab as well, so but Gurgaon, I'm not sure. But if it is not, you are the first student from Gurgaon as well. So am I happy? Today I have a student from Manipur, and then I have a student from Gurgaon. Hina Jos, good afternoon. Binila Blessing, good afternoon. Savit Beju, good afternoon. So happy to see all of you. And what does 𝐁𝐻 Academy has in store for you? We give training for n number of linguistic exams. If you want to know more about it, please do not hesitate to contact the number. They'll be happy to assist you. Anumol Matthew, hi, good afternoon. Jilmi Joy, good afternoon. And also, why the reason? Okay, we ask you to like, follow, or share, and so to subscribers to make sure that you do not miss, because we have been always on the aspect of the verge. We have been evolving. And Jinsi Jiskari, after some time, Jinsi, good afternoon. We have always evolved from your valid feedback. So we always believe whatever that is going to be benefited, you would always, these are all, whatever the updates that we have done is all because of your valid suggestions. Okay, so students have been telling us a lot of things, and we have incorporated reading. We have started again in another different time. We have started listening classes. We have started speaking depictions. We have, of course, 𝐁𝐻 madam comes in front of you with the writing depiction. So everything is because of your valid feeds. So do not hesitate to let us know what you feel, and whatever possible, we would always incorporate it. Manju good afternoon. After some time. Gina Marcos, good afternoon. New name. If you have not yet liked, if you have not yet followed, if you have not yet clicked the like button, if you have not yet clicked the subscribe button, please do not hesitate to click it. Kalyani Rajagopal, good afternoon. So are you all ready for today's session? I'm not going to waste your valuable time. Are you all ready for today's session? If so, give me a quick thumbs up and say, yes, I'm ready. What are we going to do? We'll be doing two things. One, a part B. The other one is a part A. Part A, which I've already shared. And the first hand information about what is a part A material will be there in our exclusive reading Telegram page, where we have just pinned. Wow. Shiny Rose, good afternoon. Attending the live session for the first time from Andaman and Nicobar Islands. And you are the first person from Andaman and Nicobar Islands. So I have been blessed to make sure that I have friends across. Next time I visit Andaman, I have another person. Next time I go to Manipur, I have another person. Next time I go to Singapore, I have another student. Okay, fair enough, fair enough. Rajani Vinu, first time, good enough. May I know where you're from, Rajani? Tangasudha Reddy, Dia Peter, yes. Dia was the first person. I mean, Dia was also new, but didn't tell me where you're from, is it? Right. Kalyani Reddy, Monica Reddy, Shai Joseph, yes. Korean Reddy, Manju Eti Reddy, Binila Reddy, Hina Reddy, Prajisha Reddy, Anumol Reddy, Manju Reddy, Reshma Reddy, Jinsi Reddy. All right, good enough. So first we'll be discussing a part B where the material will be popping up on the screen and you will have a timer ticking 2 minutes. And your job is to make sure that you find an answer on or before time. And as soon as the timer finishes or before, you just have to find an answer. Hannah Varghese, good afternoon. I'm ready. Good enough. Nisha Chako, ready. Shiny VS, ready. So now you will have the material. GB Varghese, ready. There you have the material on the screen. Please do the material and then we will discuss. Right. Time doesn't wait for anyone, isn't it? Because it just goes so quickly. But although Monica was a very kind of sweet gesture, because for all the new members, welcome to the best platform of 𝐻𝐻𝐬𝐧 family. Very nice of you. Thank you very much. Sanjay is already. Annie, how are you? Enjoying your life in Ireland? Miss the whole team. How are you doing? We're all doing good. Thank you very much, Annie. It is very, very, very sweet of you to come in between and inquire about all of us. Very sweet about you. I hope you're loving your lovely time in your dream country. Monica done, Manju George done, GB saying Shine done, Anumol done, Jean Bino done, Prajisha done, Korean done, Hina done, Chai done. So I have got few answer options. So please do let me know what is your answer and where you got that answer. That where is very important for us. Not just what is the answer, where you got that answer from. I can see it's few A and B and all coming in. I want you to tell me what is your answer, where you got that answer. That where is very important for us to rectify. If it is right, appreciate it. If it is wrong, we are here to correct you. So Manju George was the first one to say B, middle part of the para. Okay, fair enough. Neetu George, our immense supporter who's sharing and who brought in another friend saying B from middle part. Dia Peter B, Jean Bino B from middle, Shine Johnson B from middle para. Okay. Surya Susan done. Tina Shonai B. Reha, good afternoon. B from middle para. Monica Vegas, C from the whole para. Okay, fair enough. So I have all the three answer options, isn't it? A, B, C. All those three things are possible. Hina Joes, B. Korean Thomas, B middle part. Anumol Matthew, B from middle of the para. Kalpana, my latest student from Manipur, middle para. Okay. Dia Peter, B from middle. Lini Molvergi is nurses can order medicine. Okay, fair enough. Reshma B, middle para. Right. Now I have just got a gauge about it. And I am not telling that all of you have written, but I know that most of you have written, so I appreciate, because there are few fraudulent people available right in front of you. Okay, so please be aware of those kind of fraudulent people. They will message you for some unethical thing or unwanted thing. Please do not reply to them. Just report them and block them. Okay, this is just to keep you safe. We will not send any message to any one of you. Okay, that is one guarantee that we have. That is why we are telling, if anybody messages you, just report them and block them. Okay, do not think even to look even to that message. Just report them and block them. Sheen B, Sheena Sabu, Renita A, Sheena Sabu B, Shiny B, Savit A, Jinsi A, Sidhu C. Right. Now let's see what are the things that you have to be very cautious when you're doing part B. See, unlike part A, part B, you're supposed to read the question first. So always remember, you're supposed to read the question first, and as you read the question, underline the keywords of the question. Mega Charles, good afternoon. After some time, Mega. Right. So, Annie, how am I? Doing good, Annie. How about you all? Enjoying your lovely time with new lifestyle in Ireland and all. Good enough. So sweet of you. Okay. Again, I have to tell you, highly appreciated. Now, back to question. This policy document states that nurses. So that means it is saying something that the nurse should. Okay. Now, how you would relate it is in part B, you have to relate it along with your question and the answer. Okay, now see, this policy document states that nurses must sign a paper form if they want any new stock. Laisamma, good morning. Policy document states that nurses can order medicines from the pharmacy in some cases. Susan Machako, good afternoon. Nurse states that nurses should speak to the pharmacist if a drug is needed urgently. Claudine Lewis, good evening. So now you understand, isn't it? When you read the answers alone, you will not relate it. What is the meaning of it? So you have to relate it along with the question. Once you do that, then it is easy to identify. Now let's see. So stock requisitioning. If stock levels of medicines are low, the nurse should firstly liaise directly with their ward-based team to arrange urgent stock replenishment. So what is the first thing that they do? If they don't have the stock, whom they should deal with the ward-based team to arrange urgent stock replenishment. If, now comes the next thing, if ward-based team is unavailable, now when these people are not there, then what you do? The nurse should complete a request form online, email it to the pharmacy stores. Okay, and then on top of that, they are saying paper-based ordering systems are available. Example, the ward medicine requisition book. However, these should not be relied on if ward stock is urgently needed. See, this paper-based can be used, but not for urgent thing. Okay, at-risk medicines, diazepam, codeine, phosphate, cocodamol may only be ordered for stock when a paper requisition is written. So they are giving you some medication which have to be based on paper. So paper-based requisition should be complete, legible, signed, and then sent to the pharmacy department. Wards, clinical areas using Medieval 365 cabinets will have orders transmitted automatically to pharmacy on a daily basis as stock is used. So they are talking about some new invention where as soon as you take it gets replenished. Okay, now must sign a paper form if they want any new stock. Is there saying? No, that is not there. So they are saying that is only for paper based ordering. That is the only time they are going to sign a note. Okay, now can order medicines from pharmacy in some cases? Yes, they are saying initially who should be, they should ask for the ward-based team. If it is not available, they can fill in a form. So slightly pointing into B. Now should speak to the pharmacist if any drug is needed urgently is nowhere mentioned, because not nowhere mentioned means pharmacist is nowhere mentioned. The only way that if you need urgently is what? You complete a request form online and email it to the pharmacy store. You don't have to talk to them. So that is why it is eliminated. So congratulations for all the students who have got the right answer, which is B. So how would you mark that as B? You bubble the appropriate letter. Clear? So people who have got B, as what Reha is doing, do enjoy, keep on dancing. Good enough. Anybody else have any doubts with regards to how I have told you? If there is any doubt, no, that is why I got this answer. If there is any doubt, please do clarify. If not, we'll move into part A. Kurian is saying done. Okay, Kalyani understood. Tangasudha clear. Anybody else who got the answers? You didn't interpret the same way as what is expected. If you have any doubts, please do clarify. If not, we'll go to Sidhu clear. Okay, fair enough. G and B no clear. Okay, fair enough, fair enough. Monica next time. Don't worry, it's always there, isn't it? See, our job as student and our job as trainers is to make sure that we are correcting you. And your job as a student is to make sure that you're rectifying, you're recorrecting your mistakes. See, we are all human beings and we all do make mistakes. Mistakes are the stepping stone of success, so do not worry. Sonu Shaji clear, Minu Shijo clear, Reshma clear, Shine Johnson happy, Anumol clear, Anna clear, Vinci Sandeep clear, Rashwini Dari clear. Okay, lot of new names, yeah, but fair enough. So happy to see all of you there in front of me, even though it is virtual. So because there is no doubts you have asked, we'll move into the next one. What is the next one? The next one is called Part A. So what is today's Part A? I'm going to tell you it is peritoneal dialysis. I want you to tell me how you felt about today's material, how many minutes you took to complete Part A. Renita clear? Fair enough. Eagerly waiting to see what are your, what can you say? Rectified. Very good, Monica. Anju Muralidharan, clear? Okay. What are you thinking about today's Part A material and how many minutes you took in order to complete? And please, the reason why we share it a bit early is for you to make sure that you take a print out of it and work on it. Manju George, 12 minutes easy. Kalpana sir, where will I get the material? Kalpana, we've just pinned. There are 2 places or 3 places where you can easily get that. One is the very same page that you're watching. So please do like like the button and follow the button so that every time when we upload it to the very same page, you will get the material. Or please do give a request to join the exclusive reading Telegram page. That is where the first-hand information of 𝐻𝐿 Academy material come. And if you have not yet joined the WhatsApp channel, there also we are giving the material. Monica, easy material. Kalyani Rajagopal, easy 13 minutes. Shine Johnson, easy 13 minutes. Sandhya Clear, Renita, easy 14 minutes. Anju Nair, easy, good material, 14 minutes. Fair enough. Excellent. Suzama, easy material, 12 minutes. All right. Korean, 12 minutes and 34 minutes. Absolutely stunning. Keeping track of the precise time. Very good. Kalpana, thank you very much. It's my pleasure, Kalpana. I have to say thank you, isn't it? And thanks to your so-called lovely buddy, 𝐻𝐿, because of her, you are also attending in front of me. Reshma, today part A, easy. Little bit confused, 14 minutes. Good enough. Sandhya Bijoy, 13 minutes. Right. So generally about hovering between 12 and 14 minutes, which is quite good, isn't it? Not bad at all. Right. Now, what are the things that you have to be very cautious about? First and the foremost thing is to know what is the strategy. And the other thing is about how important keywords is. Because even when I'm just going through my new batch, okay, students feel that, as always, they don't understand the importance of keyword. But as always, we know that students are always highly enthusiastic enough to learn. So they know the importance of keywords and they change as well. So good enough. Akila Shan, good afternoon, sir. Good afternoon. So now the material will be coming up, but anyhow, done within time. So the material will be popping up on the screen, and after that, we will be discussing. So what are the things that you have to be very cautious about when you're doing part A? See, don't go to the question first. Okay. So what is the strategy? Why the purpose and all those things. So 15 minutes is what we have, and we have to tackle 20 questions. Okay. Now what is the strategy? Strategy for part A is called skimming and scanning. Scanning, as I've always mentioned, you're all well versed with scanning. You're looking in detail. Skimming means quick look. Generally they say, 𝐻𝐿 George, thank you so much for your lovely words. Thank you so much for your lovely gesture. It's very kind of you to tell that to another student, because you also feel that, yes, that student can also be benefited, which is highly appreciated. So they say 1 to 2 minutes is what you take to scan. But I would say take only 15 seconds to skim through the text. How many texts do we have? We have 4 texts based on one common theme. So 4 texts into 15 is about 1 minute. Done. Okay. Now, what are the things that you have to really be cautious about when you're skimming? See, skimming, student doesn't understand. See, again and again, I'm telling you why, because I have to keep on repeating so that you start recorrecting. See, students underline like this: peritoneal dialysis treatment that removes waste and toxin, blood, kidney can't adequately. Now, if you underline like this, it's not going to be of any benefit to you, because your eyes doesn't focus on what is needed. See, keywords should be keywords. Clarina, good afternoon. So I'm just going to show you how to skim. You're going to quick read it, okay? Don't read word by word and all. Quickly read to understand, okay, text A is about this, text B is about this, text C is about this, okay? You have to know what is the difference. So I'm just going to show peritoneal dialysis treatment that removes the waste and toxins of the person's blood in the kidneys and can't adequately function. Adequately, kidney damage occurs in the worst over time and due to health issues, diabetes mellitus, high blood pressure, a group of disease called glomerulonephritis, which affect the filters of the body, genetic diseases, when the polycystic kidney and cyst may involve the medicine in the kidney that will include the long-term pain relievers such as aspirin, ibuprofen, and naproxen sodium. Done. Ivira, good afternoon. So like this, you should skim only those words that is needed. See, don't expect that all the words that you're underlining will be the answer, but most of the word will be. Likewise, you have to go skim each text. So here they are talking about 2 types of peritoneal. So anything with regards to the types, go B. And here it is saying the complications. So any issues, any complication associated, or what you can say, the adverse effect and all those things, go to C. And of course, D is a study. So anything with regards to a study, go to D. After this, you're going to go to the question. So just to look into depth, 20 questions divided into 3 types. And these 3 types and the number of question numbers, all those things should be by hearted along with the instruction. Don't waste your valuable time. So 1 to 7, these type of questions are called match the following question, where you are expected to write only any of these letters, A, B, C, D. Don't write anything else. A, B, C or D, any of these. And you may use any of these letters more than once. Clear? Now I'm going to show you the importance of keyword referencing. See, keyword referencing means part A is purely synonymous language. They will give you the same word in a different way, either in the text or in the paragraph. So that is why keywords are very, very, very important. Okay, don't try to comprehend the answers in part A. You're supposed to check where those keywords are mentioned. See, terms for peritoneal dialysis vary and predominantly conducted during night. So types are where? Types are where? B. Understood. Now just to show you why. There are 2 types. It is done throughout the night. That's it. Understood how you refer? Good. Now see, reasons for dialysis patient to experience subsequent weight increments. So where are they talking about with their weight? Complication? Is it? So where is complication? C. Clear? If you want to know where exactly, it is there in C. Why? Because the weight gain and all those things are mentioned in C. Isn't it? See, it's causing you weight gain and all those things. That's it. Now see, contributory elements fostering the formation of cysts in kidney. So cysts in kidney, you have just read, isn't it? What causes? Genetic and all those things. The type, genetic including the polycystic kidney, causes many cysts. That's it. A. Primary area for the initiation, that means the beginning, onset, infection following peritoneal dialysis. So where are they saying about all these? Again, it should be there somewhere in C, isn't it? They're saying about the procedure that comes in. So an infection of the abdominal that due to peritoneal. So all those things, infection, saying in C. Good enough. I can see all of you are writing right answers. Good enough. Reasons behind the exclusion of numerous patients. See, exclusion study done. You don't even need to worry about it. That's the only place where people are being excluded. So study. How does taking different medication exacerbate? Exacerbate is a very common terminology that you get used to in reading renal function. So where are they talking about all these exacerbations and all? Kidney may often become worse due to these health issues. Then various modalities of peritoneal dialysis available. So what are the different types of things available? So where are the types mentioned? B. Done. See, you can easily finish 1 to 7 in a minute of time if your skimming is proper. Now the second set of questions. These set of questions are called short answer question, where the instruction clearly says the answer can be as simple as that of a word. Short phrase. Short phrase means anything between 2 to 3 words, or it can be words or numbers or both. 7 out of 7, 𝐿 Ivira 7. Good enough. Keep it up. Reshma 7. Good. Shine Johnson 7. Absolutely good enough. Keep it up. Sandhya Bijoy 7. Good. Monica Vegas 7. Excellent. Jean Bino 7. Very, very good. Manju George 7. Okay, a lot of 7. Excellent. Susan 7. Good. Right. Now a constellation of maladies. Okay, I love that word. Constellation of maladies. Even though it sounds very, very different, but it's very small. Okay, the meaning is very commonly related to cluster of disease. That's it. Okay. Reshma, keywords are really working. Am I happy? Hats off to you, because thank you very much. Because when you substantiate what we are teaching is benefiting, the other students will definitely believe it. Thank you very much. Renita 7, Korean 7, Soumya 7, Josmi 7. Very good. Now the constellation of maladies that could impact the renal segments responsible for blood filtration. So where are they talking about all these keywords? So a group of disease, there is the constellation of maladies called glomerulonephritis, which damage the part of kidneys that filter blood. So the answer is 𝐺LOMERULONEPHRITIS. Excellent. What is the minimum age criterion for inclusion in the study group? So study group, go to criterion, where are they saying? This is a bit challenging, isn't it? I like that question, this one. So they are saying minimum age criterion to be included in the study group. Okay. Now here what are they saying? Excluded less than 18 years of age. So if you want to be included, what should be the minimum age? 18 years. Clear? Good enough. Excellent. For patients finding repeated peritoneal dialysis inefficient, that means keeping on doing is inefficient, alternative procedure might be advantageous. So what is the alternative for repeated peritoneal dialysis? So again, which one is the alternative? So peritoneal dialysis becomes ineffective after continuous use of several years. So repeated, the patient then needs to shift to hemodialysis. HEMODIALYSIS is the answer. So daily, at what frequency can continuous ambulatory peritoneal dialysis be repeated? So what is the daily frequency is being asked. So where are they talking about the daily frequency? They are saying continuous ambulatory peritoneal dialysis is CAP day. So what is that? They are saying it should be repeated 3 times. So the answer is 3 times. Don't say a day because the question already has daily. Clear? This is by keyword, yeah? Now, next question. Within the cohort, so again, go to study, go to D, isn't it? Individuals with depression, how many have undergone kidney transplantation? So study, so they're saying depression, kidney replacement. So renal transplantation, how many? 16. So the answer is 16. Good enough. So due to the prolonged presence of dialysis fluid, which anatomical region expresses the strain? So dialysis fluid strain, where are they talking about all these keywords? Again, it should be there somewhere in C. So what are they saying? So an infection of the abdominal lining is there. So patient's abdomen is mentioned because it's a persistent of the procedure. So what are they? They are clearly saying somewhere. Yes. They are saying, see, filtering blood, dialysis solution, it stays in the body. After body is infiltrated, solution moves, remain in the removed along the ways. This procedure holds the fluid in the abdomen for a long duration, then that may strain the abdominal muscles. Very good. ABDOMINAL Question 14. For how many hours? So again, time is already given. We know that it is asking you about time. Must an individual remain tethered to the machine overnight? Overnight, APD. Where is APD? APD is there. Overnight is there. How many hours? It is 10 to 12. Because hours is already given in the question. So the final stint, these are called fill in the blanks question. So fill in the blanks question, you should be very much careful that redundancy is not occurring. So here it is very similar to that of short answer question, the instruction. You just have to see Surya, don't write 10-12 because it is not mentioned in the paragraph. As what is given in the text to try to replicate. I'm not saying maybe your answer is right or not. It's not that. We don't know. So what is given, the people who are conducting the exam have clearly mentioned that it should be as given in the text. Okay. So even though these are called fill in the blanks question, strategy doesn't say. Sir, if I write 10 to 12 hours, then I'll be ignoring, will I get half mark? Unfortunately, Kalpana, there is no half mark system. It's either 1 mark or 0 mark. Because the word is already given, hours is already given in the question, you're not supposed to write. Okay. The least number of patients excluded from the study group that either had dementia or, so study group go, now excluded where least 8 is not, least 19 is there, 35 is there, 43 is there, least is 2. So dementia is the next keyword. So what is the other thing? Psychotic disorder. 𝐵𝐭𝐶𝐻𝐿𝐼𝐶_DISORDER. For individuals, the influx of extra calories from the dialysis solution may intricately, so lovely words usage, isn't it? So intricately, that means it is going to affect, intricately contribute to the heightened blood sugar levels in who, where, what. So they're clearly saying this is a complication. So definitely go to C. Now where are they talking about? It should be there in the first part of C. Why? Because extra calories is there. If the patient has diabetes, the extra calories can lead to high blood sugar. So the answer is diabetes. DIABETES. The peritoneal dialysis serves as a therapeutic approach to removing DASH and impurities from the bloodstream with renal function is inadequate. So definitely somewhere peritoneal drainage, therapeutic option, toxins, waste, blood, kidney. So what is the only thing which is missing? Toxins is missing. Waste is already there, impurities. So the answer is toxins. TOXINS. Question 18. The DASH autonomously instills. So instills, that means it begins. Abdominal cavity with a solution before expelling the solution with the waste into a sterile bag, facilitating its retention. So where are they talking about all these? So definitely during some place where they are saying what? The cycler automatically fills the abdomen with solution, allowing it to drain the solution into the sterile bag. The answer is cycler, CYCLER. Question 19. Apart from the catheter associated infections, an infection of the DASH can be that can ensue consequences of peritoneal dialysis. So something which is of a cause of peritoneal dialysis. So again, something about the cause of it. So they are saying what? So an infection of the abdominal lining can also develop due to peritoneal dialysis. So abdominal lining, ABDOMINALLINING. So the ultimate question in CAP day. So where is CAP day? CAPD is right. So in CAPD, the patient connects a tube to the catheter, empties dialysis fluid into the belly using a bag, and then drains it all through a manual DASH process. So where are they talking about all these keywords? Should be there during procedure, isn't it? So CAPD is as such only there in B is a machine-free. Manual is there. All the other keywords are there. So it is a hyphenated word. Very good. You are expected to use, when a word is given as with the hyphen, you are expected to copy that. Machine-free is the answer. So I have wrapped my 20 answers. It's high time that you start telling me what are your total scores, or if you have any doubts, you're always welcome to clarify. Do you have any doubts? Please do shoot. Any doubt with regards to any of the questions? Would be happy to assist you. Any doubts? 20 out of 20, Manju, George, absolutely good enough. Excellent, keep it up. Reshma, 18, good enough, good enough. Irira, 19, excellent, keep it up. Savit, 18, very good, keep it up. Shine Johnson, 18, good enough, keep it up. Any doubts with regards to any of those questions? No. All right. So I'm so happy that I have met a lot of different people from today. Even more happy because I have a student from Manipur, I have a student from Singapore, I have a student from Gurgaon. What else could you ask for, isn't it? So I hope we are all benefited out of what we are doing. Okay, Sidhu, age 17. And of course, we will be really happy to welcome all of you again tomorrow. Until and unless I see you all tomorrow, Adios from me. God bless you all. Take care. Bye.